diabetes care and education specialist, and welcome to WOW Wednesday. I am delighted to be here with you today to go over some recommended health checks for people who are living with diabetes. I know that you don't have the opportunity to communicate verbally on this platform, but I would encourage you in the chat just to jot down what type of diabetes you have, whether it's prediabetes, type 1, type 2, uh, gestational maybe, and how long you've had the diagnosis. So if you can, just take a quick minute as I'm going through the slides and share that information. So welcome once again. The agenda for this afternoon is we're going to talk about the specific routine checks that the American Diabetes Association recommends for patients living with diabetes. At the end, I'll kind of do a check your knowledge just to see just how well that information stuck in regards to what tests you should be getting and when. And we'll take a moment before we end to go ahead and specifically set up our next health check if there's not one already in place. So we'll give you the opportunity with our support here on the platform to encourage you to get those tests scheduled before we end. Firstly, I just want to say that when I do these talks, if anyone has been on any of my previous presentations, you know I hate the idea of just talking. I love the idea of interacting and having exchange. So I say that to say that as I'm going through the slides, if there are questions or concerns, please do not hesitate to jot them in the chat, and we'll take a few moments before we end to address those concerns. All right, so annual checkups. The American Diabetes Association recommends that each person living with diabetes get routine health checks. The specific tests includes kidney function tests, your blood pressure, your blood glucose through what's called the hemoglobin A1C. And we want to know the results and keep up with those results because they can help to identify and manage the potential complications that we can see with diabetes. So depending on how those numbers are, will give you the opportunity to be proactive in taking additional steps to either delay or prevent the complications from occurring. So timing of these routine tests. So if you have diabetes, more than likely you are familiar with the term A1C, and the hemoglobin A1C is a test that is done every 3 to 6 months. It gives us an average of your blood glucose during the course of the last 3 months, 3 months specifically. The cholesterol testing, which is referred to as the lipid panel, that should be done annually. The blood glucose, blood pressure monitoring should be done at every doctor's visit. So each time you go to the doctor, there should be doing a blood pressure check. Once a year, your kidney function test should be done, which is referred to as the microalbumin tests. And additional routine checks include things like annual dilated eye exam, a comprehensive foot exam, dental exams, as well as receiving an annual flu vaccine. So quick review, that A1C test should be done anywhere between every 3 to 6 months, depending on what your numbers are. If it's elevated, then more than likely they will repeat it sooner than later. So instead of 6 months, it will probably be repeated within that 3-month time frame. That lipid panel or your cholesterol test should be done at least once a year. Your blood pressure should be done at each doctor's visit. That kidney function test which is known as the microalbumin test, should be done annually. And again, other annual tests includes your eye exam, your foot exam, dental exams, and that flu vaccine, getting that vaccine once a year. Feel free as I'm going through the slides because this is important information, and if need be, it might not be a bad idea just to jot down this time frame and the name of these tests so that you can be your best advocate when you do follow up with your doctor in regards to being informed, asking about these test results, how they're doing, in these time frames that you know it should be done.
Maureen, are you clicking
Yes.
through the slides? Because I'm still at the initial slide.
I'm sorry?
Are you clicking through the slides? What slide
Yes.
are you on?
Oh, 5 of 16. Are you not seeing it?
No.
Oh
Can
no.
you see
Okay.
it?
I'm moving through. Yeah, mine is moving through. You
Um,
know what? Let's do this. Let's end slideshow. Let's see if we can do it this way.
I think I have to click it. Usually, once you click it,
Oh
I see your
no.
mouse. Can you click on number 6, see if it's working?
Number.
Okay, yeah. Now it's working. I think
Okay, so let's go back. Oh my goodness, all this time I'm talking.
yeah, I
All right
didn't
then.
know. It wasn't moving for me. I'm not sure if for the participants it was.
All right, then here we go. All right, so we know we started here and we went to the agenda, the annual checkup. We talked about the timing of the routine testing, and we're here now. A1C. All right, so as you all know, that hemoglobin A1C, A1C for short, it measures the average blood sugars in the last 3 months. So very important. It's almost like it's your report card. You want to keep up with this each time you do go into your doctor's visit, asking about what your last A1C was. It is a key indicator on just how well your blood glucose is being monitored. The goal is to keep it less than 7%. Now, the reason 7% is in place is studies time and time again suggest that patients who have an A1C above 7%, they're more at risk for the complications that we see with diabetes, right? So if your A1C is extensively above that 7%, it is to your benefit to make some lifestyle changes or that doctor to adjust the medication or the recommendations for you to get that A1C in target range. Because once again, you want to minimize and keep your risk factors down. Okay, so again, that A1C, consider that the staple feedback as to how well your blood glucose is being managed in the last 3 months. Oops. Yeah, I can adjust it. All right, so the lipid panel, which is a test that will check to see how your overall cholesterol levels are doing. And in the panel, there are different tests that are done, right? So we have what's considered the total cholesterol, which is the overall amount of cholesterol that is in the blood. The goal is to keep that less than 200 milligrams per deciliter. Again, feel free to write these numbers down because I encourage you for your next doctor's visit, when you ask about your lipids, you want to do assessment as to how well your numbers compare to the target or the goals that are set by the American Diabetes Association. All right, so another one of the lipid panel is what's called the LDL, which is referred to as your bad cholesterol. And the higher this number is above 70 for patients with diabetes, the higher the risk of heart disease, right? So you want to consider that LDL kind of a close relationship to the amount of blockage that may be in our blood vessels, right? Because when we have plaque that's built up in our blood vessels, it makes the blood that much harder for it to flow. And obviously, if it's very blocked, you won't have blood flow, which is pretty much what heart disease is, or a heart attack. So again, keeping that LDL level low is going to be your goal. So less than 70 milligrams per deciliter is the goal for the LDL. The HDL, which is referred to as the good cholesterol, is the opposite. We want that number to be high. For men, we want the number to be above 40 milligrams per deciliter. For women, we want that above 50 milligrams per deciliter. High levels of your HDL actually protect you from things like heart disease. So what's the difference? LDL, what are some things that may make that number high? Obviously, your fried foods, your fatty foods, things like red meat, all play a role in increasing that bad cholesterol level. HDL, foods that will influence that and help that number to increase are things like your healthy fats, right? So olive oil versus, let's say, corn oil or canola oil. So olive oil would be a better choice. Healthy fats are things like your avocados, nuts, olives, all considered healthy fats, your salmon, and also exercise. The more you exercise, the higher that HDL tend to be, and the more you exercise, the less that LDL tend to be. Now, triglycerides are a type of fat in the blood, and the goal is to keep that less than 150 milligrams per deciliter. Now, things that affect your triglycerides are things like fast food, alcohol are the things that come to mind. So again, I tell you this so that you can, if the numbers are off, you can make some adjustments. Let's say the triglycerides are really high and you tend to eat out like 3-4 times a week. In order to address that, you may want to eat out a little bit less to see if that number would improve over time. So once again, the lipid panel includes your total cholesterol, your bad cholesterol, which is the LDL, your good cholesterol, which is the HDL, and your triglycerides, which is a fatty kind of fat that you find in the blood. Okay? All right, blood pressure. Now, and by the way, let's go back. This cholesterol or lipid panel testing should be done at least once a year. So once a year, your doctor should be doing your lipid panel, and each year when it's done, you want to compare what it was last year. So again, I'm promoting, encouraging you to be your best advocate and have an active role in how your numbers are holding up for these routine exams that pretty much is painting a picture as to how well your health is with this condition, diabetes. So again, blood pressure should be monitored at every doctor's visit. If you do have a diagnosis of hypertension or high blood pressure, it is a good idea that you invest in a blood pressure monitor, and you should be checking regularly at home. Not a bad idea at all. You can get it at Walmart, you can get it at any one of the pharmacies, and depending on your benefit plan, you may even be covered for one. So it's just a good idea to have one. Just like you're checking your blood sugars regularly, if you do have high blood pressure or hypertension, it should be a practice that you are doing on a regular basis. The goal for your blood pressure is less than 130/80. If in fact, there are no other conditions, different people may have different target. depending on your individualized circumstances. But for the most part, as a general rule, the American Heart Association recommends less than 130/80. All right, so I mentioned those kidney function tests, and specifically the kidney, or if you don't know, it's the organ that is able to filter out the toxins in our bodies, right? And when or if the high blood sugars affect the cells in the kidney, they are not able to filter as well, which would result in a higher than normal protein level. So that is what is detected in what's called the microalbumin test. That test should be done at least once a year, right? If you have diabetes. And again, it is checking to see just how much protein is in the blood. Too much is a sign of kidney damage. And as a general rule, your target for your microalbumin is to keep it less than 30. So once again, that microalbumin, which is the kidney function test, should be done once a year with a diagnosis of diabetes, and you want the results to be less than 30. I am curious, are you guys familiar with the microalbumin test? Is that something you have been monitoring? Is that something that your doctor discussed with you at your visits? If so, go ahead and share that information in the chat, please. All right. Next, we're going to talk about eye exams. Everyone with a diagnosis of diabetes, whether you are type 1, type 2, or even if you're pre-diabetic, it is the recommendation that you have an annual dilated eye exam. And that should be done by a MD who will dilate your pupils. They're looking in the back of your eyes to assess how well the blood vessels are doing, right? Because we know that with prolonged hyperglycemia or exposure to high blood sugars, the blood vessels, whether in the eyes, in the the kidneys, or in the blood vessels that goes to your extremities, they can be affected. High blood sugars tend to destroy cells, nerves, and tissues, and the eyes definitely can be affected. So those blood vessels can be affected by prolonged exposure to high blood sugars. So the dilated eye exam assesses the blood vessels to see just how well they are doing, right? So you'll get drops in your eyes, it'll dilate your pupils, they can look to see how healthy the blood vessels look. Now, the good thing is these exams are able to detect if the blood vessels looks to be at risk. Let's say it looks weak and it looks like it may be having a slow bleed. It can be addressed in a timely fashion, things like laser or any other mode of treatment to address it before it gets too bad. Because if it goes undetected over time, blindness can result, right? So that's why it's recommended that it's done every year so that it can be assessed. And if there are any risk factors that shows that these blood vessels are showing signs of deterioration, that it can be addressed before it becomes an irreversible situation. Now, one of the most common complications we see with diabetes is something called retinopathy, which is exactly what I just described. It's where the blood vessels in the back of the eyes pretty much, they may have a tear, which could result in a bleed, which can result in vision impairment and ultimately blindness if it's not treated. So Very important that you schedule this annual dilated eye exam. In addition to the dilated eye exam, depending on your age and circumstances, they will also assess for glaucoma and cataracts during that visit. Okay, now let's go to your foot exams. And again, let me go back. Share in the chat how many on the call can share if they have been getting their annual dilated eye exam. If you can just kind of share in the chat if you have been getting your annual dilated eye exams, yes or no. All right, so now let's talk about foot exams. Once a year, when you go into the doctor, your doctor should be doing what's called a comprehensive foot exam. And that is where your doctor will ask you to remove your shoes, your socks, and they want to do one, an inspection. They want to look to make sure there are no bruises, no cuts, sores, that's not healing. They want to look at your nail beds, make sure it's nice and pink and not, discolored. They want to check the pulse, make sure you have good blood flow to your lower extremities. And they'll do a microfilament test. And I'm not sure if you guys are familiar. It's where they'll it's one of two things. They could use a tuning fork where they'll kind of do like a buzz and ask you, can you feel it? Or they'll use something that is similar to a fish line and ask you to look away or close your eyes, and they will run it up the sole of your feet and ask, can you feel it? And they're checking for sensation in your lower extremities, right? So annually, this should be done for everyone with a diagnosis of diabetes. Now, mind you, I'll be honest, a lot of doctors, for whatever reason, may not necessarily do this. So this is where you, being your best advocate, I'm encouraging you to mention to your doctor, hey, I haven't had my comprehensive foot exam done this year. Can you just check and tell me how is the circulation in my feet or my lower extremities? And encourage them to do this test. Very important. Now, if you do have a diagnosis of neuropathy, you especially want this exam to be done because there are times with neuropathy that if you have it, you'll know you can't necessarily feel what's happening under your feet, right? And so what that means is if you do in fact have a cut or a sore that may not be healing, and if you're not visibly assessing your feet, that little sore, cut, or bruise can progress to something bigger, which can develop into, gangrene, or even worse, leading to, really horrible consequences. I don't even want to say the word. So again, I encourage you, have that comprehensive foot exam done annually. And as a diabetic or a patient with diabetes, I encourage you to do a daily foot exam. And what that means is inspect your feet, make sure there's no cut, sore, bruises. If you do notice a cut, sore, bruise and it's taken a longer than usual time to heal, as a diabetic, don't be shy. Have that conversation with your doctor to find out what they recommend to enhance healing. For those of you who have a difficult time seeing under your feet, invest in a mirror, maybe at the dollar store, put it on the floor, kind of lift your feet up and kind of see what's happening underneath. But whatever it takes, just take really good care of your feet and inspect them on a regular basis. Obviously, wear comfortable shoes, nothing that's going to put any pressure on any of your tendons or, your skin. So again, just using really good caution to protect your feet. Okay. The obvious signs of neuropathy are things like burning, tingling, numbness in your lower extremities, cuts, sores, or bruises on your lower extremities that are taking a longer than usual time to heal. Again, share this information with your doctor and make sure you're following the recommended treatment to avoid things getting worse. Okay, so I keep forgetting. How many of you are doing daily foot exams, and how many of you are getting comprehensive foot exams annually when you go to see your doctor? Please share that information. And we're going to take time at the end to go through your responses. All right, next we get to dental exams. Very important for patients who have diabetes to have their regular dental cleaning. The recommendation is every 6 months. Again, the oral cavity being exposed to high blood sugars put it at risk for gum disease and gingivitis. So you want to make sure that you are practicing good oral care at home. You're seeing your hygienist or your dentist on a regular basis for your scheduled cleaning. You're going to check once again for anything like periodontal disease and treat if need be in a timely fashion. And it's a good idea just to share with your dentist that, hey, I have diabetes, so that they can take particularly, pay particular attention to things like gingivitis or gum disease with your condition. And how many of you are getting your routine dental exams? Please share. Now, this is very controversial. I know a lot of people are hesitant to take the flu vaccine. I can only share with you what the American Diabetes Association recommendations are, and that is that you do take that flu vaccine if you have a diagnosis of diabetes. So the rationale is that when we are sick, and if you've had the flu, it's not just a common cold. It pretty much can do quite a bit, to your blood sugars, to the way you eat, to the way you function. And it's considered a stressor on the body, right? Because everything is off. It's like you have an infection. So your stress hormones are released, your blood pressure, your blood sugars are elevated, and it just throws everything off course. So to reduce the risk of that, the American Diabetes Association recommends that everyone with a diagnosis of diabetes gets that annual flu vaccine. Whether it's at your doctor's office, at the pharmacy, or your health centers, just make sure you're getting it to reduce the risk of coming down with the influenza or the flu. And as I said, influenza can be a serious risk for people with diabetes. There are people who, if they experience the flu, their blood sugars get so high that they can go into what's called ketoacidosis, where your blood sugars are elevated, your electrolytes are off, and it would warrant hospitalization. So once again, to reduce the risk of that, the risk versus the benefit, the benefit versus the risk is higher. So the recommendation is to go ahead and take that annually. How many of you are getting your annual flu vaccines? Again, please go ahead and share. All right. So, in summary, there are a couple of tests that I want you to become familiar with the diabetes diagnosis. On a regular, each time that you see your primary care doctor or your endocrinologist, that blood pressure should be checked. The A1C should be done at least every 3 to 6 months. And your weight should be assessed, usually done at every doctor's visit. And the obvious labs that we talked about, things like the microalbumin, the lipids, um, the eye exam once a year, the comprehensive foot exam once a year, your dentist for your cleanings every 6 months, and most importantly, to reduce the risk of the flu, to get that annual flu vaccine. All right. So let's take an opportunity now to do a quick test of your knowledge. We just went through it, and while you jot the answers down, I'm going to take a look at your responses so far. But if you can, share with me, how often should you have your blood pressure checked as someone with diabetes? And this is where I'm going to take the time to look at your response and see just how well you remembered. All right, I'm waiting on your response. How often should that blood pressure be checked? Good, good, good. You guys have been getting your exams. Wonderful. Okay. So thank you. It says, somebody said here, check at least 3 times daily. Ooh, okay. Definitely, I mean, if there's concern, then you want to stay on top of things. But at least each doctor's visit is the correct answer. And yes, if you do have a diagnosis of hypertension or high blood pressure, you should be regularly checking it at home, depending on how your numbers are doing, to determine how often per day. So thank you for that. It says D, every doctor's plus several times at home. Wonderful. All right. How often should your doctor assess your weight? Every visit. Right. Now, we didn't go a lot into weight, but weight is a factor, especially when we're talking about diabetes, right? Because the weight can affect your treatment, meaning if you are increasing weight, then more than likely your dosage or your treatment options would also have to increase. So weight is a factor in managing your diabetes. You want to maintain as healthy a weight as you can. So each time that you do go in for your doctor's visit, that assessment of your weight should give you some feedback as to, hey, do I need to start maybe looking at the amount of calories I'm taking in? Do I need to exercise a little bit more? What are the things that may be affecting my weight and causing either increase or decrease? So checking that weight on a regular basis, at least every doctor's visit, is recommended. And that is the correct answer. Thank you for those who have inputted. How about the A1C? How often should your doctor check your A1C? So annually, at least, and that's the minimum. Um, it doesn't, well, let's say you're seeing your endo every month or every other month. Would that A1C be necessary? I am curious as to this response. You're seeing your doctor every other month. Would it be necessary to do that A1C? And this is a trick question. Not every visit. I'm not sure what R, that might be a typo, but I think the question is, If you're seeing your doctor less than 3 months, it's not been 3 months yet, should the doctor repeat that A1C? And this is important. I really want your response on this because it would kind of let me know if you understand the concept of A1C. Perfect. So the answer is correct. No. So because it is a 3-month average, you wouldn't be getting it done sooner than 3 months because it wouldn't capture the true value as to what that A1C is. So it cannot be done sooner than 3 months. Now, if the numbers are normal, more than likely your doctor will repeat it in 6 months. If it's abnormal, they may repeat it in 3 months, but typically not less than that 3 month from the last time that it was assessed. All right. How about the comprehensive foot exam? How often should your doctor do a comprehensive foot exam?
Hey, Maureen. Once we answer
Yes.
this question, I think you missed a question on the micro album albumin.
Oh, wonderful. Thank you for letting me know.
Yes.
Okay. All right. So, comprehensive foot exam, someone said every 6 months, once a year. No. Wait, 1238. Someone said 6 months. Does everyone agree with R? R said every 6 months for the comprehensive foot exam. Let's see, does anyone disagree? Yeah, so D, correct. Once a year is what the guideline recommendations are for that comprehensive foot exam, at least once a year. So, I mean, I wouldn't necessarily go, you didn't check my feet in the last 6 months. If they did it at least once a year, then they're within target for the guideline recommendations. Now, that doesn't prevent you from doing a daily foot exam, which is actually encouraged. If you have diabetes, you should be on a regular basis, daily if you can. Check your feet, make sure there's no cuts, sores, bruises that's not healing, and, share with them any concerns that you have for things like tingling, burning, or numbness that you may be experiencing. All right, so let's circle back to microalbumin. Does anyone remember how often that microalbumin test should be done?
Yeah, I think there was a question on the difference between the microalbumin and GFR, and then what lab test shows microalbumin.
Okay, so the difference between GFR and microalbumin, is that the question?
Yeah, that's one question.
All right, so we'll try to get to that. But does anyone know about the microalbumin? Based on what we discussed, how often should that test be done? Okay, each year. So once a year for the microalbumin, at least once a year. All right then. Lipid panel, does anyone remember? Each year. So I will just say everything going forward, just as a quick review, is once a year, with the exception of the dental exam. And you guys know that is every 6 months that the recommended cleaning is for keeping up with your oral exams or dental cleaning specifically. Okay. All right. So the question was, what is the difference between microalbumin and GFR? So I am familiar with microalbumin as that is the test that can actually, it's one of the staple tests that we use for predicting how well your kidney is functioning. When we're talking about the GFR, let me just do a quick research here because I think it's good to know. All right, so the GFR, and someone asked this, I'm not sure if they are someone managing a kidney condition, but it is GFR stands for the oh gosh, I'm gonna mess this up. Glomerular filtration rate, right? And what that does, it measures how well the kidneys are filtering blood, which is pretty much what the microalbumin does too. And the normal GFR is you want that to be high. So you want it to be above 60. When it's lower than 60, it may suggest chronic kidney disease. So just if you want to monitor both, the takeaway that I'll get, because this is not something I'm very familiar with, but the takeaway is ask about both, during your follow-up exams. Just know that that microalbumin, you want it to be less than 30, and that GFR, you want it to be above 60. Both of those tests are assessing how well your kidney is functioning. The microalbumin tends to be the test that is used, generally speaking, to assess diabetic kidney functions. The GFR is also done, but I think once you have an established kidney uh, diagnosis of maybe chronic kidney disease or something, they pay more attention to that GFR. But in a nutshell, to answer your question, they both pretty much assess kidney function. And in regards to knowing your numbers, if you do get those lab results, just know that the GFR, you want it to be above 60, and that microalbumin, you want it to be less than 30 to suggest that your kidney is doing the job it's supposed to. Okay, great question. All right. So now I've actually asked a lot of the questions and you guys answered. Thank you so much. I want to take a minute now to see if I missed any input. So thank you again for sharing how long you've had diabetes and the type that you have. Oops. Um, Okay. I don't think there was any other question specific to the presentation, was there, Ashley? All
I
right.
don't see any. Wait, someone's
All right.
speaking.
All right. So here's a question. Uh, when is your next doctor's visit? And if you don't have a doctor's visit, what's getting in the way of you scheduling that visit? Let's kind of brainstorm together to see how we can get you on board to getting these routine exams. And it starts with connecting with your primary care doctor so that they can order these tests to get a full assessment as to how well you're doing with managing your diabetes. So, what lab tests show the microalbumin? So, the lab test itself is called microalbumin, which is a blood test, or it can be a urine test, either or, that will assess how much protein you're spilling in your urine or in your, right, in your blood or your urine. So I don't know if that answered your question, D. What lab test shows the microalbumin? It's again a blood or a urine test, and the name of the test is microalbumin, which assesses how much protein you are spilling. You don't want to spill too much protein. Anything above that 30 milligrams is going to suggest that there is some kidney concerns. Okay. R had a valve replacement, so he follows with several doctors, but most of them he sees quarterly. Very good. So can you share with us, are any of these tests things that you keep up with? Do you have this conversation with your doctor about the results? Or is it just that the tests are done, it's in my chart, and you just assume it's fine? Okay, so D says his GFR is 47. So based on what we said, what is your understanding, D? It could be that you may be managing a chronic kidney condition, or it could be something that is acute and they're just monitoring. So it is definitely something to talk to your doctor about and find out, is there any treatment that can help the GFR to improve? I mean, is it a diet thing? Is it a medication thing? There are medications that are on the market that actually helps your kidney functions or reduce the risk of kidney damage. So conversations to have with your doctor, if any of these numbers based on what we shared today is kind of off, are you a candidate for anything or any suggestions, any lifestyle changes to improve the numbers to be closer to target? So R said, I visit via phone for details on test results and actions going forward, which is excellent. Again, I'm glad that you're visiting your doctors regularly. What I encourage you to do is to be more involved with the results and try to have a clear understanding as to what your numbers are compared to the target goals that I shared with you today. All right. So in the last 10 minutes, I would encourage you all, if you are someone on the call that have not had an annual dilated eye exam in the last year, I encourage you to schedule that. If there are any barriers to you getting that done, please share that on the chat, and maybe we can brainstorm to see what resources may be available. The same for your dental exam. If you have not had a cleaning in the last 6 months, I encourage you to go ahead and get that scheduled. Most importantly, that doctor's visit. You should be seeing your doctor's visit every 3 to 6 months, because that's where the bulk of the testing would be done. Once again, that's where you'd have things like your blood sugar, your blood pressure, your weight, your labs done, like your lipids, your kidney functions, your A1C. So most importantly, one, if you don't have a doctor, again, share that on the chat. This is your opportunity for us to maybe share some resources with you. And two, get it scheduled if you have not seen one of these doctors or had these tests that we discussed today in the last 3 to 6 months. Wonderful. D had the flu shot, R had the flu shot, dental exam by R every 6 months. Is there anyone that is not actually inputted? Ashley, is there a shy one? R gets the foot exam. I'm seeing R, D, lots of input. Who else is not kind of sharing? And is this an opportunity for us to maybe share some resources to make this that I recommend happen for you? Not I recommend, the American Diabetes Association. So if I get no input, it seems to me then that you are all good. Uh, Ashley?
Yeah, I don't see.
No, no other?
Mm-mm.
All right. Well, as Ashley mentioned, for those of you, maybe if you're not comfortable sharing on the platform, just know that the Diabetes Association of Atlanta is an excellent resource for helping our patients with diabetes. Their information is on the screen, along with their phone number and email address. If there are any, health barriers, definitely reach out and connect with one of the coordinators there to see about exploring some resource options. And that is all I have. Unless you guys have specific questions, feel free to share them.
I'm gonna let people type out questions if they have any. But I just want to say thank you, Maureen, for today's session, and thank you everyone for joining us. Remember, this is a monthly webinar, so we will have another Wow Wednesday next month. I'm not sure of the date, but it's every fourth Wednesday of the month at 12. And you can just follow our social media, keep an eye out on our website for any updates on registration and the topic. Um, I feel like
Wonderful.
no one's typing, so I think we
Maybe
can.
I take that as a positive. That means that they got the information, no questions, I hope.